If you're a cat owner, you definitely know the sound. That unmistakable heaving noise that has you scrambling for the paper towels. You know, cat vomiting is one of the top reasons people bring their cats to the vet, and it can be really worrying. So today, we're going to break it all down.
So you hear that sound and you're thinking, why is my cat throwing up? Is this just a normal cat thing or is it something serious? Well, you are in the right place. In this explainer, we're going to get clear on what you're actually seeing, what to look for, and most importantly, when it's time to pick up the phone and call your vet. Okay, let's get into it.
All right, first things first. We have to figure out what's actually going on. I know it seems obvious, but what looks like vomiting could actually be regurgitating or even coughing. And telling the difference is a really important first step for both you and your veterinarian.
The key word here is active. Vomiting isn't just something that happens passively. It's a whole body event. You'll probably see your cat acting nauseous beforehand, maybe licking their lips a lot, drooling, or being restless. Then comes the heaving. You'll see their belly muscles contracting. It's like their body is an engine, forcefully pushing something out.
And you can really see the difference here. Unlike that big effort of vomiting, regurgitation is totally passive. There's no heaving, no big drama. The food just kinda slides back out, a lot of times right after they've eaten. And because it hasn't really been in the stomach, it looks pretty much undigested, sometimes even in the shape of a tube. And just to make it more confusing, coughing can sometimes produce foam too. A great tip, if you're not sure, try to get a quick video on your phone. It can be incredibly helpful for your vet.
So now that we have a better idea of what we're seeing, let's get into the why. This is kind of the investigation phase, right? Because the reasons a cat might vomit are all over the map, from something super simple to something a bit more complicated.
Let's start with the usual suspects, the really common stuff. You know, a hairball once in a while? Pretty normal, especially if you have a long-haired cat. Does your cat gobble down their food like there's no tomorrow? Yeah, that can do it. A slow feeder bowl can be a game changer there. And of course, a quick switch in their food or munching on a bit of grass can cause a little upset stomach. A lot of these things tend to fix themselves.
But sometimes, vomiting is your cat's way of telling you something more serious is going on. It could be a sign that they've swallowed a piece of string or a toy and now have a blockage. It could be a reaction to a poison, or it could be a symptom of a bigger health issue like kidney disease or an overactive thyroid. This is exactly why frequent, persistent vomiting is something we always take seriously.
Okay, now this is where you become the lead detective in your cat's case. Seriously, the things you notice at home are absolutely critical clues that help your vet figure out what's going on and how to help.
So, what you actually see in the vomit can tell us a lot. If it's just yellow liquid or bile, that usually just means their stomach was empty. White foam can point to some inflammation in the stomach. But, and this is a big one, if you see bright red blood or something that looks like black coffee grounds, that's a sign of digested blood. It means there's bleeding happening somewhere, and that's much more serious.
All right, this slide is your action plan. If you see any of these things, don't wait it out. Call your vet right away. When a cat vomits multiple times in a row, especially if they're also weak or have diarrhea, they can get dehydrated super fast. And if your cat already has a known health condition like diabetes, this is definitely an emergency.
Okay, so you've made the call and you're heading to the vet. I know this can be stressful for both you and your cat, but knowing what to expect can really help. So let's quickly walk through what that visit might look like.
See, the whole journey starts with you. What you've seen at home is step one. Then your vet will do a complete physical exam, feeling their belly, checking for dehydration. From there, they might suggest some tests. Blood work gives us a look under the hood at how their organs are functioning, and imaging, like an X-ray or ultrasound, can help us spot things like a blockage. It's all a very logical process to get to the bottom of it.
Once we have a diagnosis, the whole focus shifts to treatment and getting your cat feeling better. And the good news is, there are a lot of great ways to manage vomiting once we figure out the why behind it.
The treatment plan is always going to be tailored specifically to your cat. Sometimes it's as simple as putting them on a bland diet for a few days. Other times, we might use medications to control the nausea. If they're dehydrated, giving them fluids is absolutely key. And of course, if we found a specific underlying disease, we'll treat that directly.
And this really sums up the whole approach perfectly. Vets have three main goals here. Number 1, fix the root cause. Number 2, stop the vomiting itself so your cat can feel comfortable. And number 3, correct any other issues that have popped up like dehydration. It's a full circle approach to get them back to their happy, healthy selves.
So after going through all of this, just take a second to think, what's one new thing you'll watch for now?
Maybe it's just being more aware of the difference between a real vomit and a hairball. Or maybe it's paying closer attention to the color. The whole point is to move from just being worried to being an empowered, observant owner.
And if you remember just one thing from this whole explainer, please let it be this. A single, isolated episode of vomiting can be perfectly normal. But frequent vomiting is not. It's a sign that something needs to be looked into. You know your cat better than anyone, and you are always their most important advocate.
Remember, this information is for educational purposes and is not a substitute for professional veterinary advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.